The Hunter region is a geographical area based around the Hunter Valley in New South Wales. It's about 200 kilometres north of Sydney, and Newcastle is the capital of the Hunter Valley. It's based on the eastern seaboard, and the population currently in the Hunter Valley is just under 2 million. The Hunter Medical Research Institute is a collaboration between the University of Newcastle and the Hunter New England Area Health Service to deliver really better research outcomes and better health for our community. It came about 13 years ago in 1998, post the closure or the imminent closure of BHP. The region was looking for knowledge-based economies to grow, or knowledge-based employment opportunities. And it was decided that the two big research organisations in the Hunter, so the University and the Area Health Service, wanted to come together with a common strategy for building research capacity and employment opportunities in the Hunter, but also to have the ultimate outcome of having better healthcare delivery and better health for our community. And so the two organisations formed a joint venture, which eventually became the Hunter Medical Research Institute. It's very inception to be a partnership with the community to ensure that the research that we're undertaking was really driving better healthcare and better outcomes for our community. So that was where it started from, and it started from a small group of researchers, about 100 researchers working in the university, and the Area Health Service came together under that umbrella to really grow the capacity. And now this year in 2011 we have just under 1,000 researchers working for the Institute, and they are driving research that is not only relevant to our community but has global impact for the outcomes of their research around the world. The Hunter Medical Research Institute is currently building a $90 million facility on the John Hunter campus, and that came about through a strategy to bring all our researchers together from 8 different campuses around Newcastle to consolidate them down to 3. And the first building on the John Hunter campus is really to bring together 400 researchers who are aligned with the clinical services in John Hunter Hospital. So all our researchers who are involved in children's health, in asthma and respiratory disorders, infectious diseases, the pregnancy programs are all coming together in a single purpose-built facility. And the strategy behind that is to ensure that you integrate your research into clinical practice. And by having them side by side with the hospital, it allows our researchers to work with the clinicians and healthcare professionals to ensure that they take up the messages from research very rapidly, and it leads to rapid translation of better health practices, better health policies, and hopefully better healthcare for our community. Medical research is really a global profession, and people working anywhere in the world contribute to that global knowledge about healthcare problems. And the people who are working for the Hunter Medical Research Institute collaborate with people all around Australia and all around the world in their specialty field. They attend conferences or exchange knowledge with each other, and it's very important then that the research outcomes actually get translated into better healthcare practices and policy. And that happens by interacting with the clinicians to ensure that the best evidence that comes out of medical research is actually being translated into changes in healthcare practice. And so it not only changes the practices in the hospital that the researchers are working with, but it will flow to the national and international communities to change their policies as well. When people go to their doctor for help with a healthcare problem, they may not actually think of medical research, and particularly for some people where there are not good treatments or there are no cures currently available, they do understand that medical research offers them hope for the future. And a good example of some of the research that we're doing here is in multiple sclerosis, and it unfortunately is a very debilitating disease, but the research that is being conducted here offers those people with MS a significant hope for the future in terms of understanding the disease processes, understanding the genetics behind it. And we've been very fortunate to have some very significant international breakthroughs through a genetics international consortium. And the people who have participated in our clinical trials now have hope for that there will be cures for the future. And if they don't see it in their lifetime, they know that the research is offering an opportunity for future generations to be the benefit for their participation in the research trials now.
Research Australia is proud to be associated with the Hunter Medical Research Institute. Research Australia is the peak advocacy body for health and medical research in Australia. More health and medical research means improved health of Australians. And let's face it, improved health means better lifestyles and able to focus on the things we enjoy doing.